doesn't matter what kind of penis you have. All penises are great penises.
Hi everyone, today we have with us Dr. Tanaya, popularly known as Dr. Cuterus. She is a millennial doctor who's internationally trained and she specializes in creating awareness around sexual health. So let's get her to bust some of the most prevalent sexual myths that we know. Okay, so is it true that wearing an underwire or sleeping in a bra can cause breast cancer?
Absolutely not. Underwires do not cause breast cancer. Sleeping in a bra doesn't cause breast cancer. With that said, if you are wearing an underwired bra, try to give yourself breaks because it puts a lot of pressure on your rib cage, and sleeping at night without a bra is great because it lets you loose and lets you
relax.
Yeah.
Okay, so talking about penises, circumcised penises are considered to be more pleasurable for both men and women. How much of that is true?
Not at all. Circumcision doesn't make a difference to your sexual pleasure. Some people do report that they've felt a little bit of reduction in sexual pleasure after circumcision because it takes away a lot of nerve endings, but that's only a few people. Really, it doesn't matter.
Can you get pregnant while you are on your periods?
Technically, yes, the likelihood is low. Basically, sperm can survive for a long time. They can live in your vaginal tract for like 5 to 7 days. So if you have a cycle that's really short, and you're on the 3rd day of your period, and you ovulate on the 8th day, तो फिर हो सकता है. But the likelihood is low, to be honest. Even then, the bigger thing to remember is that it's important to use contraception, particularly condoms, on your period because at the time of your period, your cervix is a little lower, so infections can happen a little bit more easily, which is why you should be a bit more careful.
Now, vaginal smell is something which is looked down upon. Is it actually bad and something which needs to be fixed?
If it's an actual bad odor, then that can be a sign of an infection or something going wrong, in which case you need to go to your doctor. But the vagina has a natural and very normal smell that doesn't really need to be fixed. The vagina will never smell like roses. And just like if I smell my skin and I say, oh, why does this not smell like roses? There's no need to fix this. With that said, again, if there is an actual bad smell with other symptoms, then absolutely see a doctor.
Do breast implants stay forever?
There are several complications that can happen after breast implants. The most common one is called encapsulation, where basically what happens is that now your body is seeing that this implant is something new that's not been there. So it starts treating it as a foreign object, which means it starts building a hard shell around it. So this fibrous encapsulation can be a very common side effect of breast implants. Unless you're getting some sort of a reaction or an infection, they can really stay there. But then it starts looking disproportionate with age, and all of those issues are there. We also need to refill the implants depending on what is the filler inside them. So depending on what size and what type of implant you have, the maintenance changes.
Can orgasms lower a woman's risk to heart disease, stroke, depression, or even like breast cancer?
We don't have enough evidence on breast cancer, but everything else, yes. Orgasms release some really good feel-good hormones in your body, which can reduce your blood pressure, which can make you a little bit more de-stressed. They can relax you, and there are significant cardiovascular, which means heart and blood vessel related good effects of orgasms. It also helps you sleep better. It also, because the feel-good hormones are there, you feel nicer after it. Can be great for stress busting. So let's not put it in the way that they will treat these conditions, but they can reduce your risk or reduce the stress of certain conditions on your body.
And make you feel like because of the feel-good hormone.
Absolutely.
Great. So these are few of the myths that you've busted for us. Thank you so much. But I think there are many more which you have busted in your book, and there are a lot of other facts also in your latest book, and congratulations to you on that. Just tell me something little bit about the book, and why do you think that book is something that the Gen Zs and the millennials should get a hold on, especially when it comes to sexual health?
So I think my favorite fact about my book is that it's in a very easy to understand language. It's in, I'm using lots of memes, I'm using lots of pop culture references to help people understand these things better. And unfortunately, most of the information we get around sexual and reproductive health tends to be, for lack of a better word, bullshit. So this is coming from a verified source. It's a very scientifically educated book. I'm a doctor, so I know what I'm talking about over here, and it's meant to be a fun, breezy read that helps you become friends with your body, as opposed to get 100% marks on your board exam.
Great. So I can't wait to get my hold on that book, and thank you so much for joining us today.
Thanks for having me.